You have tuned into The Voice of Medicine, the medical podcast filled with remarkable stories, first-hand experience, important research, and valuable life lessons. Open your mind, relax, and enjoy. Hi there, everyone. I hope you had a wonderful week full of success and healthy, active lifestyle. So today, my guest is an anesthesiology consultant. She is a speaker and a coach, especially for women. Sasha Shillcut is the founder of the movement Brave Enough, where she's helping mostly female scientists and female medical staff to work their way through career paths and be more accomplished as much as possible. She's going to explain why it is important to take care of yourself in terms that you have a balanced lifestyle, not that you end up with a burnout or any psychosomatic problems like that. And maybe she will deliver us a solid path on how to combine career and family.
So, when I want to get to know somebody a little better without the possibility to talk to them before, I look at what they're writing, right? So, and I went through your blog, and you do so many things, but one of the things that you do, the activities that you took up on yourself, is developing leadership skills for your community. I was thinking leadership always goes sort of hand in hand with failure and dealing with failure. Because from my perspective, when you are a leader, doesn't matter if it's a company or it's an association or whatnot, people are looking up to you. You are basically the person who sort of calls the shots, who makes the pathway, who has to take the responsibility of certain decisions. But this puts you on a spotlight, right? And I was always asking myself, how do you teach people not to be afraid of failure, even if they are the leader, because that's the pressure that you can only experience when you are in that position?
Yeah, that's a very good point. And I think that the biggest thing is there's a lot of stress on an individual when they are a leader in the spotlight, as you described. But there's actually more peace and more freedom when you give yourself the permission to fail. Because when you give yourself permission to make mistakes and learn from them, you hold the key to how that failure affects your future position or promotion or leadership or growth. But when you fear failing and you're constantly trying to hide your mistakes, you give that power to everyone else around you, because basically you're saying, like, I'm going to let all of my environment dictate whether or not it's okay for me to fail and the result of that failure. So it's actually much more, you're much more at peace as a leader when you are open to make mistakes and failures and actually talk about them in your environment or in the culture you work in, because you also give permission as the leader for everyone else to make mistakes and bring those forward. And that's how everyone grows. So most of us grow not from our own mistakes, but from watching other people fail and make mistakes. And so while we do, it is important to grow from our own mistakes. If people aren't sharing their mistakes, especially in medicine, or their failures, there's not room for the whole community to grow. So I think that it's a balance. Obviously, there's, as someone who's in the spotlight, you don't talk about every single failure that you experience, personal failure or professional failure. But I think it's important for leaders to have transparency, because they're setting the stage for the people around them to admit failure, which is how we learn and how we, prevent mistakes in medicine, how we prevent therapies and treatments and system problems that aren't working. How we prevent future problems is admitting our failure. So we have to give ourselves the ability to say we ourselves are giving our permission to fail, and we set the tone for how that failure affects our next step.
Mm-hmm. So it's sort of an active management of the failure perspective, and we have it in our hands. And you actually, for me, you opened Pandora's box when you said failure in medicine. This is something what I am actually missing in the open discourse when it comes to healthcare and medicine. People do not like to admit that even doctors, doesn't matter how good they are, and we're dealing with conditions where sometimes you can do your best and still you might fail, people might die. But I guess because the stakes are so high, the topic of failure and medicine is not something that is actively talked about even within the community. What's your take on that?
That's correct. And I think that we know part of it is the personalities that are drawn to medicine and the culture of medicine. We tend to be perfectionists, and we tend to have standards that are extremely high with no room for error. And because of that, it creates a culture where the negative thing of that is that people are extremely afraid to admit when there was a mistake made, or when they failed to do something, or when they did everything possibly in their power and no mistakes were made, but the outcome was poor. Even that we don't want to talk about, even when we did everything possible. And so it creates this kind of culture of perfection. And perfectionism, which many of us in medicine always have been taught that that's a really good trait, it's actually a very bad trait to be a perfectionist. And it's something that, as a patient, you may be thinking, gosh, I really want my doctor to be a perfectionist because he or she is going to take excellent care of me. But the reality is that we're human, and no one is perfect, and no system is perfect. We work in systems that are imperfect and are human. And there are always mistakes that are going to be made, or there's always failures that even if we don't make a specific mistake, that we have a bad outcome. So we have to be able to talk about those and learn from those and improve our systems. And the only way we can do that is by admitting our mistakes and failures. So you actually want a physician who is very transparent and is honest and is able to see that there's no way he or she can be perfect.
So when I was listening to you, I thought, well, this denial of failure or possible failure probably drives the expectancies of patients also pretty high, more than they should be. So, I've seen this a lot of times. People come to a doctor and they go like, well, do your thing, make me healthy again, whatever it takes. And then the doctor might be a perfectionist and he might be an expert in his field, but there is only so much that he can do. So I completely agree with you that more transparency. So a doctor who tells his patients, listen, this and this is possible, but that is not, no matter who you talk to, it's probably what we really need.
Right.
Is this culture of perfectionism and also this maybe a contributing factor to why so many people in healthcare, especially doctors, but it's also nurses and other members of healthcare, why they're dealing with high rates of burnout? And I know we're facing increasing number of patients, less and less recovery time. I mean, you wrote about this as well, and perhaps, in my opinion, sometimes this obsessive optimization for efficiency in healthcare. I see that when people outside of medicine and healthcare come into healthcare and they start to McKinsey the thing up, so to say. What's your take on this? Or the general thing of burnout and medical staff?
Well, I think everyone is talking about burnout, and we all know people who have quit medicine or who have suffered either personally or their family has suffered from either them burning out or developing, negative habits such as substance abuse or suffering from mental illness and breakdown and even suicide. We all know people in medicine that have battled different elements of burnout, and we see it and we're all talking about it, but we have to actually need our leaders to take charge of systematic issues to change the mismatch between how physicians and nurses care for patients and how the healthcare organization is run, because there's a mismatch. So we have, on one side, we need to see as many patients as we can. We need to be really safe in our practices. We need to not make mistakes, but we also have to see all these patients so that we have a huge demand. And then we have providers, physicians, nurses, physical therapists, PAs, nurse practitioners, pharmacists who went into medicine, who are drawn to medicine for the very human aspects of it and caring for people and helping people. And what they feel that they have become is a machine that is very inhumane. And so at the same time, you have all the stress on you to see all these patients and, do all the clicking in the electronic medical record and finish your compliance stuff and do all these things and paperwork and all that, and regulatory issues. But you also, the thing you're missing is actually what drew you into medicine. And so what our metrics for achievement have changed. It used to be like a really good patient interaction was a measure of success. But now our measures of achievement and success are numbers and RVUs and things that we can generate, how many patients and money. So there's a disconnect between how we are measured as doing a good job, as achieving. And I think that leads to a lot of conflict, and it leads to loss of engagement, because you become totally emotionally empty because you don't have anything filling you up. There's not that joy in medicine anymore. And we don't like to talk about this because it seems soft and it seems like touchy-feely. And, these are not the conversations that are being had or being welcomed in leadership circles, but that is actually what we need to talk about, is how do we get people in medicine taking care of patients doing that and not doing, and how do we get people and systems to support them to do that at the same time making healthcare efficient.
Another thing, you have been promoting or telling your colleagues to take a time off when they feel like something is not okay with them, that they're being overwhelmed with all this, maybe go on a vacation or something. And what I thought was, well, the last time I wanted to go on vacation, I had to work twice as hard before the vacation and twice as hard after the vacation. Yeah. You know what I mean? So it's, so I guess, and I'm probably not the only one.
Right.
Probably not the only one. So a lot of people say, you know what, vacation, if I go, I'm going to die before and after. So why would I even go? And maybe they will, even during vacation, they will not be able to switch off from work and just enjoy. So how do we deal with that?
Well, you bring up a very good point, and that's called work compression, when you have more to do in less time. And so, and this is one of the reasons in healthcare why so many people do burnout, is because the way that we have more to do in less or the same hours. And so the work compression of the day is much different than it was 30, 20, 15 even years ago. So this is another reason why people are burning out. And when I tell people who come to me in kind of a crisis mode of burnout, and people feel a lot of guilt, we feel really guilty when we burn out, like we've done something wrong. But I tell them to take an immediate 3 to 5 days off, and they all look at me like I'm crazy, because that's the last thing that they have time to do is take time off. But the reason that I tell them to take time off is not because I think that a vacation is going to fix their burnout, but it is going to bring clarity and to what needs to change. So when you take time off and you actually get away from the work, you can do some self-reflection and evaluate what needs to change in your life. Maybe it's your place of employment. Maybe it's an area that a position of promotion that you've been doing, but is actually really burning you out. Maybe it's a specific area that you're working in that is toxic, but you can't see it when you're in the midst of it, because all you're doing is just on the treadmill trying to survive, because you can't get off the treadmill. Or you have to get off the treadmill to see that. And so that's when I tell people, you need to take time off stat. And they look at me like, are you kidding me? I can't take time off. I'm so busy. I'll have twice as much to do. If you feel like you can't take any time off, that's exactly when you should be taking time off, because that means that you have no work flexibility. You have lost control of your work flexibility, and you have to figure out how to get it back. And the only way you're going to do that is by spending hours by yourself to do some self-reflection. And I lead a class actually where I take physicians through this, because it takes like intention to figure out how to get back to the joy that you once had, or your work life that you actually enjoy.
So you step out of this devilish circle to gain clarity, perspective, and most of all, as you said, you're teaching awareness of what's going on, right?
Right. It's not like you're going to go on vacation for 3 days and you're going to be like, oh, I'm suddenly better. I've developed high resilience and now I can handle all these. No, you stepped out of that so that you can say, what is going on in my life that is not healthy, that is I've overcommitted to? How can I either delegate or change this workflow? Or maybe it's time for me to take a step back and realize that I need to make bigger changes. And that's what happens when we give ourselves time, is we gain clarity to how to fix the problem. It's not like, I'm saying like a 3-day yoga retreat is going to just fix all your problems.
Okay, I get that. Another thing which I wrote in one of your blogs is, at least, correct me if I'm wrong, but I had the feeling that you're a big fan of mentoring, right? Mm-hmm. And I am too, to be honest. I think it's very important that young professionals in any kind of sector, but I think in healthcare and medicine, junior docs, they need somebody who helps them out and kind of guides them in certain things, right? From your own perspective, I don't know if you had a mentor or if you are mentoring somebody right now from the younger generation of doctors, but in your opinion, what are specifically the upsides, advantages if you have this sort of mentoring, maybe even embedded in the culture? So it's not, 1 in 100 people that actually does have a mentor, but maybe everybody should have somebody like that.
Yeah, I think one of the big kind of falsehoods about mentorship is that you have to be older than the person you're mentoring, or you have to be in the same exact specialty or area. And I don't think that's true. There are a lot of people who I consider peer mentors that help me with issues that I may be having that are my peers, but they will give me good wisdom or advice. And I think it's really important that you have many mentors. Now, there is something to be said for an official mentor-mentee relationship. I have a couple mentors or mentees that I am menteeing right now. And when we meet, I always say, bring the 3 things that you are working on, the 3 things you need from me to help you with. And so, in 30 minutes, if we knock out 3 things, that's really great. And it's intentional and it's focused. So you want to have a very focused and, you want to prepare for any meeting you have with your mentor. And mentors will mentor you. People will mentor you even if they don't know you, if you ask them specific questions. So when I hear people say, I really need a mentor, I always say, what do you need a mentor for? List 3 things, because you want to go into the relationship having clear goals and objectives. You'll get more out of it. What you don't want it to be is just a kind of a whining or talking session where a mentor is just talking about themselves, or a mentee isn't really getting what they need from the mentor. Mm-hmm. But I think anybody can mentor. You can have, peer mentoring. You can have mentors that are outside of your institution, that are even outside of your own area of expertise. I have realized in the last couple years, I have a lot of mentors that are not in medicine. And it's really helped me in many ways because they have shown me how they have overcome obstacles in business or in technology that I would not have thought of if I went to just my peer mentors. But so open your mind to mentorship, because I think when we talk to people outside of our own institution or outside of our own specialty or our work area, we can become more innovative in our thinking, and we can gain more wisdom than we would if we just stay inside and more insulated.
So for everybody who looks for a mentor, important thing you say is definitely to have an idea what you want from that person that they can mentor you in, And then it's not a bad thing, or even the opposite. It might be a great thing to have somebody who has nothing to do with your field, because you gain a different kind of broadened view on things, right?
Yes. And, I've had many of the best mentors are people that have said to me, well, why can't you do that? And I think, well, because that's just not how we do it. Well, why not? And I thought, well, you're right. Why not? Why don't we do it this way? And there's been really good growth for me professionally from things like that. Because other people may think, well, why don't you, this is how you should do it. Or, sometimes medicine is so very protocolized and very, regimented and in our thinking. And sometimes we need to break that to actually have a breakthrough,
Another thing which I saw, and it amused me. I was very amused when I read that, was so you animate women, especially to take care of themselves. You call it, you should shine, right?
Right.
To take care of themselves in terms of appearance. And I can very much imagine that you have earned wrongly fair share of criticism from some people. I can imagine it very well. Calling you fellow and whatnot. We know who is out there. But tell me, why do you think that appearance negligence, can be a killer for a woman? And do you think that men also ought to take care of their appearance just as women? In other words, should not everybody shine?
Yeah, I do. And I think the reason that obviously I speak more to women is because that's my audience who I feel more comfortable sharing with, being more vulnerable with. But I think that self-care, which I think is anything that brings you back to your authentic self, part of that is your appearance and taking care of yourself. And I think it's really easy, especially in medicine, to just kind of go through the motions of your day and spend very little time on yourself, because you're caring for everyone else. You're taking care of your patients. You're taking care of your family members, your aging parents, other colleagues. And as a physician, especially, it's really easy to just let your own self-care and your own appearance just go by the wayside. And I think that, I get a lot of criticism for this, because I think that there are some people that see your outside appearance or any time you spend on that as shallow and fake, or promoting a dogma that women, should look a certain way. And that's not at all what I'm saying. I think that you should take care of yourself physically and mentally. And part of that is how you appear in the workplace, and how you dress, and how you take care of your health and your physicality. It's part of self-care. And I see a lot of doctors just, straggling into the hospital in the morning because they are so exhausted and they don't have time to exercise. They don't have time to even, fix their hair or shave. The men too. And so I think it's part of self-respect. And I think it's respecting others around you too. And so I'm just a very strong proponent of that, even though I've been criticized by several people, many women who are like, well, what are you saying, Sasha? I think you're putting another level of pressure on women. That's not what I'm saying. I just think that women and men should feel that they have time, at least 30 minutes to an hour a day, to take care of themselves, whether that's going to the gym and taking a shower and shaving and looking presentable for work. I think it's a part of self-respect and self-care.
You talk a lot to your female community. You are the founder of Brave Enough, which is a network of women, I think all kind of female professionals, and you support each other. And I was stunned when I read Brave Enough. So my question was, first of all, bravery. Bravery, to me, is the ability to endure bad things and the courage to face bad things instead of fleeing from them. And I thought, okay, so that's comprehensive, but why enough? Could you explain me, why did you use these two words exactly, and what exactly, or how do you make your female community brave?
I think that courage is something that I don't know a person on the planet who doesn't need courage just to get through their day. I think we underestimate the value of courage and how we all need courage to be our authentic self. So the reason that I kept coming back to this brave enough and this word brave is because people will say, wow, that's really brave. You know, you do this big thing, or you go for this job, or you get this promotion. But to me, it's like you need courage just to be who you are in today's world, because there's a lot, and especially what I see on women is there's a lot of pressure to be something you're not, and to be in this really margin of this narrow margin of, you know, mediocrity. But if you're too, you know, if you're too strong, or you're too soft, or you're too quiet, or you're too loud, and so we kind of lose our authentic self, and that requires you to be brave. And to me, it's just being brave enough. You just have to be brave enough for the next step. You don't have to be this, you know, extremely courageous person to be brave. You just have to be brave enough every day to be your authentic self. So that's why I named it Brave Enough. And I think that a lot of discontent in the workplace is because you are doing a job that requires you to not be your true self. And I'm not saying that everyone should, you know, be their worst self, because some people interpret that like they're, you know, I mean, myself, I tend to be someone who talks a lot, and I can overpower a room and not listen. So I'm constantly having to check myself to be a good listener. That's not what I'm saying when I say just be your authentic self. All of us have strengths and weaknesses, and oftentimes they're the same thing. So, you know, I'm also a strong leader, and I can get jobs done. I can mobilize meetings, and I can get people to take action. So that's a strength, but it also can be a weakness. So, but that's who I am authentically. So I know that about myself. I think a lot of why I love the words brave enough is because I just have to be brave enough to get through today authentically. I tell myself that all the time. And I think most people do. They need that courage to just be who they are. And when we are our authentic selves, and we get to actually enjoy ourselves in the workplace with our strengths, using our strengths that are unique to us, that's when we find that joy. That's when we are more successful. So that's the origin of Brave Enough.
So if I understood you correctly, it can, let's say if we stay in the workplace, it can encapsulate that I, for example, tell my boss if I'm not, if I don't agree with a certain decision that he made, or for example, being brave enough of letting one of my subordinates to do something which I would, since, hypothetically, if I was a control freak, I would let them do instead of me, doing it, make sure that it's 100%. So you think this is the way? So how should I say, discover or work with your own vulnerability?
Yes. And being honest, I mean, it takes a brave person to say, I just led a meeting and I interrupted you. I didn't let you talk. I'm really sorry about that. I'll do better next time. I mean, that's a brave leader to me. That's a leader that's being vulnerable and having self-insight and being self-aware. No one is perfect. We all make mistakes. We all have parts of our personality that are stronger than others. And I think we need to just realize that that's being courageous, is being honest and vulnerable and being brave enough for today. Just brave enough for today. That's what you need to be.
That's a wonderful advice. And I hope, all our listeners are going to try to think about that, first of all, and draw their own conclusion from that. But I think it's a very almost philosophical, powerful message that you're bringing.
Thank you.
Sasha, the last thing I want to talk to you is a little, I would say, problematic, maybe a taboo. Maybe you're going to hate me after this. Hard to say. So one of the challenges that women have, since maybe last 30, 40 years, maybe a little bit longer, is getting, the job, the career, and the wish to be a mother, be there for the family all together. And, in the past, maybe, 4 or 5 years, we hear a lot about what politics can do for us in making women more able to do both at the same time. But what I am personally missing is, where is the discourse about men enabling men to actually be fathers? Because
Yeah.
I guarantee you, from the people at least that I know, if you gave them the possibility to be at home without losing, let's say, the cultural respect, or maybe even, and this is where I'm careful about this, but I'm gonna talk to you honestly, maybe even the respect of some women. If they were not afraid that they are gonna lose this, still be loved and respected by their wives, girlfriends, and so on, they would gladly go home and take care of their children. Because I don't know a father who wouldn't.
Yeah. No, I love that you are asking this question. I'm really glad that this is you being brave. See, it's already working. My message is already working. I love that
This
you're
is me being a rebel.
I like it. I think that you have brought up really good salient points for women to think about and men to think about, because men are parents. And if women are going to have opportunities in the workplace, we know that women need support at home with the not just the childcare, but also household duties. And there's been studies done in the United States that have shown that women do about 8.5 more hours. Women physicians at the assistant professor level do about 8.5 more hours than the men that are also assistant professors, so very junior. And so there's a disconnect between the work being done at home. And part of that, I think, is also the pressure put on men to be the provider and to be the leader and to have a career. And there are several men that would probably love to be more hands-on at home and take on that role of being the primary parent and support their wife. And they do face pushback, and they do face criticism. And I think one of the positives about the millennial generation is that we're seeing more men being honest and say, look, I'm actually want to, support the kids or be more at home, spend more time with my family, which I think is awesome. Because I think that is how women will gain equality in the workplace and opportunities, is when they have supportive partners. So I know for myself, there's no way that I could achieve everything that I have achieved in my career. I mean, there is zero way if my husband was not my partner, who was so supportive and takes care of the kids and helps me a ton. So I'm very honest about that. I don't think that I don't want to be a woman who, preaches that women can do it all. You can do a lot of things if you have a supportive partner. And I think that it's important that we as women validate our male colleagues when they make decisions based on their family, that we respect them for that, that we support them to be the parent who, has to go pick up the sick child, or who, when they have to go fill in, we need to really support those men that are doing that, because they do face criticism. You're right. So I think that it will happen over time, but I think these are very dominant themes in our culture that are really hard to change. And some of it is, benevolent sexism, and we protect women, I think, sometimes because we don't want to stress them out, or we assume that, they don't want this position because they have kids at home, but they may have a very supportive partner. Or we also, and the opposite is true, maybe we criticize men for not taking roles because they choose to be with their family. So I think you bring up great points.
Well, thank you for sharing your honest opinion about this too. I know that this topic for maybe a lot of people is a
hot topic.
But it's you have to look at this thing from both sides, because family only works with two parents, at least in my eyes, to be successful and give especially the children all the love that they need. So I think if there is a way to make it work for everybody, it's this, to enable men as well to be home and actually be fathers.
I agree.
Sasha, thank you very much for taking your time having this talk with me. I've learned a ton once again.
It was really fun. Thank you so much for inviting me, and I'm honored that I could share.
This was The Voice of Medicine. Make sure you tune in next time, and take care.